Ladies and gentlemen, today I want to introduce you to a new direction in medicine. Cardiometry is a new basic science which will help to make the diagnosis of cardiovascular pathology easier, cheaper, and faster. New perspective in the study hemodynamics of the body. Cardiometry gives us the opportunity to see working of our body a different perspective, which allows us to put forward new theories and methods for more effective treatment of patients. The method is easy to use and accessible to everyone as the equipment is inexpensive and takes about 1 week mastered. Mathematics is a most accurate science. It is the heart of cardiometry, which is main advantage, which the help of mathematical formulas, we have begun to study hemodynamics from a new perspective. We can determine the volume of blood filling of being pushed out by the heart in any phase of its work and the vascular response to this one. We also access to non-invasive diagnosis methods such as determining the levels lactate, oxygen, phosphocreatine, lactic acid, and the heart muscle and spectral analysis of the heart based of mathematical calculation. This makes this work much easier for both research and physician speeding up diagnosis. In the latest research work, cardiometry has identified indicators that cannot be seen as a conventional ECG. This makes possible to improve the prognosis of patient survival before surgery and other studies. The technique also demonstrates high sensitivity to change in hemodynamics, which helps to detect the following change general population. The first step is to find them in high-risk people. The second step is older people. The third step in the general population. The method is cheap, making. Oh, pardon. Another factor is the elevation on the SLA phase and after is flattening. This compensatory mechanism to maintain dynamics, and it comes as a last resort. Here it was manifest in most cases before death. SAGs very record with smoothing of this phase. It refers of the case of adrenal heart. When calcium in a large amount accumulates in cells and destroys mitochondrial membranes, which leads to a decrease in mitochondrial contraction. This leads in the death of the patient. And we showed, and also other important indicators show decrease in variability with about 3 to 5 per minute, which may be within the margin of error. Let's see. Of error. Also, it was recorded an increase in the load on the nervous system that shows as the spectral analysis of SAG's patients. Values which vary about 1,000 units in a grade if the patients had a rise in the SAL phase. An increase in the cardiac stress index from 1,000 minimal heart rate variability and stabilization of blood pressure, they died within two weeks, while most patients had improved health. The diagram also helped us a lot due to it shows how much the blood sample to the lungs. Involved on the work there were some patients whose diagram reacted the breathing, which indicate a very strong hemodynamics load on the lungs as the heart muscle call no longer. cup the loads and some of the sun died. In the future, mechanism will be described in much more detail. My research is focused on and identified markers on sudden cardiac death, who is at increased risk of having a heart attack because their physical condition does not seem so bad, but the disease they may have is not obvious. We are talking about the general population. The first step in the find them and the high risk people. The second step in the older people is the third step in the general population. The method is cheap, making it accessible to poor countries where medicine is still developing. We can say newborn. It could be a substate for primary diagnosis in remote parts of the country, even without a doctor presence. With the ability to forward patient data to the hospital for initial diagnosis and action. Cardiometry is a promising young science, which require time for its advancements and such of the methods of application. I hope that together we can make it easier for the population to access quality medicine without significant costs. I will be very happy to continue my scientific activity here and to be happy with new data that will help. And I want to know that the data on the mathematical formula can be added to any device, SAG device, for additional information to help the SAG and in the way combine those two difference. We will be able to improve the quality of medical care many times over. Thank you very much.